Welcome to HEALTHITUDE. Today on HEALTHITUDE, we'll be discussing ulcer prevention and management. Basically, we will be finding out if this disease is preventable. If yes, how can we prevent it? And again, when one is already confronted with the disease, how best to manage it? In the studio, I have a medical practitioner with me here, Dr. Oliver Onwalu, to help in the topic. Doc, good to have you.
Yeah, good afternoon. Thank you.
You're welcome.
Thank you. It's my pleasure being here. The viewers, you're also welcome.
All right, quickly, doctor, what is ulcer? Let's start from there.
Yes, ulcer, in the layman's view, is wound. The discontinuity in the surface of a body. Just like you can have ulcer in on the skin, when there is discontinuity in the skin layer or any other layer for that matter. But for this particular topic, we are talking of peptic ulcer. That is the wound you have in a particular area in your body, that is the stomach, and some other aspect of the stomach within the intestine. We call it the peptic ulcer. And the peptic ulcer, like I said, ulcer found in the stomach, the area of the intestine. We also, immediately after the stomach, we call the duodenum. And any other part of the stomach, it can also be found there. But the interesting aspect is that the place it is found, it is commonly caused by the effect of hydrochloric acid in the intestine. Hydrochloric acid is an acidic substance, as the name shows, that normally secreted in the intestine. It has a role in the digestive process, very important. But for one reason or the other, an individual could have that hydrochloric acid eroding the wall of the intestine. And then if he gets that place eroded and the area becomes discontinuous, that is, the covering area is cleared away, that you could see what is covering, say the person has developed an ulcer. So the ulcer we're talking about is the ulcer found in the stomach and in the duodenum as a result of hydrochloric acid creating a wound in the intestine.
All right, doctor, the way you were trying to describe this ulcer of a thing, it seems there are types of ulcers. Are there types of ulcers? If yes, let us know.
Yes, there are types of ulcer. One could be classified by the region where you find them. Those found in the stomach is known as the stomach ulcer. And then those found in the duodenum, duodenal ulcer. And there are those found in other areas, not the stomach, the duodenum, but still in the intestine. It's also, for instance, the one we call Zollinger-Ellison ulcer. We'll talk about that later, where you have tissues, cells producing acid outside the duodenum and the stomach. It's outside these two areas. I see ulcer developing there as a result of acid production. So it can also be classified as a result of the cause. You know, it's interesting to know that most of the time, what we call ulcer, peptic ulcer, could be ordinary gastritis, inflammation of the gastrum, the internal wall of the stomach. And this happens to, it could happen to anybody, and it's common. It can come and go, even without medication. It could be as a result of what you have taken. If you've taken something that is irritating to your stomach, or there is an infection that gets into the stomach, it could cause the wall of the stomach to get inflamed. And could come up with things like abdominal discomfort, nausea, at times vomiting. And most of the time it goes, or it could last for 2, 3, 4 days, and may need some medication to go. But when this gastritis persists and there is a discontinuity, it has cleared that layer, exposing the internal layer of the stomach, we now have ulcer. You see? So that ulcer we now have. Some people will now say that we are ulcer patients, that have been an ulcer patient for 5 years and so on and so forth. But it is not that particular ulcer that have existed in 5 years that is continuing. This ulcer can heal today, next month another ulcer develop. If the causative agent is still there, or if it happens again. So the ulcer that happened last year may not be the particular ulcer that is happening today. Simple explanation: if you get to the abattoir where they kill cow, you can ask for the intestine. The stomach is that area we call, that internal area looks like a towel. That is the stomach. That thing that projects out at the villas, very important structures God had made. And in ulcer process, that thing is eaten off. So if you get that of the cow, you can see patches, several patches. That is several ulcers the cow have suffered during the process of its life. So it is in human beings. So some people may have suffered ulcers severally, that a good percentage of the stomach have been covered up with healed scars of ulcers that have come and that healed. And so the ulcer is not going, it's not, oh, if ulcer lasts for so long, it might either have perforate the intestine or convert it to another thing. But one ulcer heals for another one to start. So ulcer has a cause.
Okay, now you've talked about acidic productions in the system that could cause ulcer. Now, are there other causes? Because sometimes we hear that when you don't eat food the way you should, it can actually lead to ulcer. Please, let's have a clearer picture of what actually causes ulcer.
Yes, it is important to know that just like every other disease, ulcer is also a disease that has a cause. So thank you for that question. And ulcer can be caused by bacteria, Heterobacter pylori. This H. pylori is a bacteria.
All right, Doctor, I think you're going to hold it here. Let's take a short break here. The program is HEALTHITUDE, reaching you from Anambra Broadcasting Service Television here in Awka, Anambra State. And in the studio, I'm with Dr. Oliver Onwalo. He is a medical practitioner in private practice. We take a short break. The program returns after now. Please join us again. You're welcome back to the program. Is still HEALTHITUDE, talking about ulcer prevention and management with Dr. Oliver Onwalo in the studio talking to us about ulcer. Now, Doctor, we are talking about what are other causes of ulcer.
Yes. Bacterial infection, the Heterobacter pylori. This is a bacteria that exists in our environment. But when it gets to the stomach, it has the capacity to breed, erode the wall of the stomach, creating wounds there. And once erosion comes in there, and the acid in the stomach goes to that place, it worsens the situation and causes some of the symptoms we experience. And there are also some drugs we take that have the capacity to erode the wall of the stomach. The NSAID, non-steroid and pain relievers we take, like the ibuprofen, aspirin. These drugs have the capacity to erode the endometrium of the stomach.
That's the linings of
the line, things that line up the internal wall of the stomach. So these drugs are very, very important. And there are drugs that are commonly abused. They can be bought over the counter. People get it to relieve pains. And after the pain now comes the stomach issue. And then there are other situations that could worsen the ulcer condition. For instance, when we say habit, some habits like diet, the diet we take, excessive alcohol consumption, caffeine, cola.
When you take them in excess, or
when you take, abuse of it, abuse of it, smoking, and then lack of rest. That's where stress comes in. All these things promote acid secretion, and then the ulcer that has developed to resist healing and expand faster. So in the prevention of ulcer...
Oh, sorry, before we get to the prevention, you know, there's this statistics of, as according to WHO latest report published in 2018, peptic ulcer disease deaths in Nigeria reached 5,123, or 0.26% of total deaths. The age-adjusted death rate is 6.26 per 100,000 of population, ranks Nigeria 54 in the world. Now, at this point, I would like you to let us know how factual is this statistics, and again, let's know how endemic or ulcer could be, because sometimes, you know, our people is just ulcer. Some people may not really know that these things could be, you know, so dangerous, so to speak. Let me put it that way.
Yes, thank you very much. Every in the health system reporting in the health system in Nigeria is not the ideal. Cases are not properly reported. Just it affects every other disease, not even only the peptic ulcer. In our environment, you see most of our people dying with severe abdominal ache. They come when it is too late. Some have extended to stomach cancer. Some coming with other complications like perforated ulcer. All these things are ulcer-related deaths. And so the reward statistics you just now quoted is an iceberg. What is happening in our communities, you see, it's a common disease in our environment. Yes, it's a common disease. Our environment is the type that promotes such diseases. Hygiene is very interesting. When COVID came up, we introduced hand washing as a routine. This hand washing, if there is a way our people will continue sustaining it, it is very, very important. It helps in reducing a lot of the incidence of a lot of diseases, as we record in our clinics. Even peptic ulcer can also be contacted from the environment. It can also be gotten from a human being. People don't know that.
Really?
Yes, the bacteria. Somebody who has the bacteria pylorix, you can get it from the person, It can be found in somebody's saliva. It can be found in the person regurgitated substance, vomitous. It can also be found in the stool. And if it contaminates the environment, it can get to food, you can get it to your hand, to mouth. So hand washing is also very essential. And it did actually reduce the incidence of peptic ulcer within that period.
During COVID?
Yes, people did not know that. A lot of diseases, the incidence came down by that washing of hand.
In other words, I think at this point,
Yes.
it should be proper to encourage our people to imbibe that habit or that culture of hand washing or using, what is it called? Sanitizer to sanitize our hands often.
Well, even if sanitizer is not available, washing, just wash. Whether you are going to wash to eat or shake hand and wash, just find it like doctors do. Doctor, after touching a patient, goes to wash the hand. Even at times, we forgot that we've not touched a patient, we go there to wash. Somebody
because you're so used to it.
We are used to that. And then people start washing during the COVID, and it helps a lot. You see, so peptic ulcer can be gotten from the environment. You see, and then the drugs, self-medication, not all. You see, I saw a lady who came to the clinic, said, "Doctor, I've been taking these drugs, and can I see the drug you're taking?" You brought all 5 wraps of drugs. One wrap contained 15 tablets. It has them 5 wraps. I said, "Okay, how many have you taken?" He said, "You got it 25. Jesus. And you have 5 left." But the problem now, that he's not talking of the drug. That drug is very okay. He has taken care of the wounds, the pains, the arthritis. But the problem now is my stomach is burning.
Oh, God.
Okay? So when I look at the tablets, 3 tablets of ibuprofen, everything compounded there. I said, "Wow, you are strong." Because I don't know how you have taken this to this volume for this number of days, and they have not gotten perforated stomach. So that is the problem. The drugs we go to buy for one problem is now creating another problem. So more than 50% of cases of peptic ulcer in our environment is as a result of self-medication.
But
Yes.
you know, but this example of ibuprofen also.
Okay.
Yes, I thought there's something there are warnings at their park, you know, about somebody that is having a stomach whatever. There is how they wrote it. I've read it before, and I said, "No, I can't take this." But that's a story for another. Just that what you've said is a sign that people should not take drugs on their own without a doctor's prescription.
Yes.
Okay. At this point, we take another short break. The program is still HEALTHITUDE, coming to you from ABS. And the doctor in the studio is Dr. Oliver Onwalo, teaching us ulcer prevention and management. When we come back after this break, we look at whether this ulcer disease is preventable. If yes, how do we go about it? And of course, if you're down with ulcer, how do you go about managing it? After the break, we continue. All right, good to have you back. It's still HEALTHITUDE on ABS television, and we are discussing ulcer prevention and management with Dr. Oliver Onwalo. Now, Doctor, you've really told us a lot about this ulcer disease. Now, can we prevent ulcer? Because there's this saying that prevention is always better than cure.
Yes. We can prevent, or we can cure ulcer, and we can prevent it. Now, in preventing ulcer, one, identifying the causative agent, because the cause of ulcer in patient A may be different from the cause of ulcer in patient B. And then If the cause of the ulcer is the bacteria cause, you treat with antibacterial, and then we give some drugs that take off the pains, reduce acid production. In less than a week, the wound heals and the ulcer is gone. And then if it takes as a result of the NSAID, that is the pain-relieving drugs you have taken, you stop the drug immediately. You stop the drug. And if it is a result of excessive alcohol consumption, cigarette smoking, cola chewing, coffee, cocaine injection stimulates acid production in the body. It's very, very important. Cocaine is not commonly consumed in the environment, but we know some people consume it. So you can even use their money to consume what is detrimental to your health. It's also very, very important. And then the pattern of eating, what we eat. We have to understand that food rich in sugar, fat, are also inducing. And then for somebody who already have it, it makes it worse. For ulcer patients, we advise fiber-rich food, fruits that are not too sweet, like banana, the papaya,
Okay.
yes, the pawpaw, and then the pears. These are good vegetables. They are good for an ulcer patient. And rest is also when people are stressed up. It stimulates the particular nervous system in the body, just like you see the person sweating. So also is the stomach sweating in the quote, releasing the acid. More relaxed person is the lesser candidate for peptic ulcer. People reaction to activities varies. So it's important, like I said earlier, hygiene is also important. Personal hygiene, oral hygiene, all these things are very, very important. Minding what you take, they are very, very important in minimizing ulcer.
Okay, I think at
Yes.
this point you've really used one stone to kill two birds by telling us the management for people that are already, you know, ulcer patients. But at this point, there are some things I've seen people do. Some people will tell you they carry biscuits in their bag to make sure that they keep chewing something, that something is in their mouth at all times because they have ulcer. You know, how do you demystify this?
Yes.
And let our people understand which one is better?
Okay, this intermittent feeding is not helpful. You see, heavy feeding and intermittent feeding is not too helpful. We advise people just maintain a regular feeding pattern. If you are feeding 3 times in a day, it's okay. Let it be regular. And then water. Water is very, very important. Anything that is not water you take in stimulates presence of food, encourages acid secretion. For instance, if you take milk, milk initially we go there to neutralize the acid that have been secreted already, and then there will be apparent coolness, calmness, as if the ulcer has gone. But the milk will now in turn stimulate further acid production.
Wow.
Okay? Because it's a protein and it has to do the function there. But water is the best. Water goes there and neutralizes everything and does not stimulate further production of acid. So you take your regular food. If you are coming out in the morning, make sure you eat in the morning. Eat your breakfast and eat your dinner, and let it be regular. Going for 12 noon for your breakfast makes it funny. Or having your breakfast, your lunch by 4 p.m. or all this doesn't help. for somebody whose intestine is prone to ulcer. There are also certain factors that expose the intestine to ulcer. Age is also there. As one ages, the lining of the intestine gets thinner, just like every other thing reduces in effectivity and in function. But acid secretion does not reduce. So they are prone to ulcer, elderly people.
All right, quickly, doctor, for want of our time,
Yeah.
are there tests to conduct on one to find out whether the person has ulcer or not?
Yes, there are many investigations we can do to confirm.
And apart from investigation, is there a way you will feel, and you've said something like that earlier, but I would want you to stress it more.
Yes, in the physical examination, symptoms and signs which I've mentioned, and then importantly the pointing sign, the person will tell you where the pain is coming from. Oh, doctor, this pain here is getting me upset. And then when this thing progresses to a level, he also points at the back, that this pain is also reflecting at the back, because the intestine lies on the posterior wall, anterior wall of the back, and then pain can easily reflect to the back. Okay. And then if we examine the stool of patients, we can, from color, we can have dark color, because blood, when it deforms by process of digestion, changes not red again, is dark. And then even when it is not dark, we look at the microscope. There are certain investigations we could do to see what we call occult blood.
Is there a time one will present and you say it's late?
Complications. There's times when it is late, when the ulcer has gotten too big, when the ulcer has perforated, and when the ulcer have even gotten to stomach cancer. You see, because of long stay and lack of attention.
In other words, the earlier
the better.
All right, we'd like to thank you so much, Dr. Oliver Onwalo. We appreciate your time on television today.
Thank you very much.
And this is where we wrap up the HEALTHITUDE program today. Thanking you so much for being a part of it. Let's make hay while the sun still shines. My name is Nonyenwo Okoye. Bye for now.